Parents, rejoice! The kids are going back to school. Even if you're not a parent, coronavirus has affected us all in ways we would have never even imagined. The recent decision to allow kids back into school can be seen as an important milestone on our collective journey back to normal. There are some that are not completely comfortable with this decision. Thankfully, San Diego Unified School District has given parents the option of whether or not to send their kids back to school. I'd like to make a poll. Imagine you are a parent. If you would feel comfortable sending your kid back to school right now, comment right on. If you would not be totally comfortable sending your kid to school right now, hit the like button. San Diego Unified School District has reported that 73% of parents are sending their kids back to school, and 27% of students will be staying home. Whether or not you're a parent, this decision to send most kids back to school affects us all collectively in various ways. My name's Nathan, and I'm a parent of a fourth grader. I was not completely comfortable sending him back to school until recently. I've researched the risk and prevention strategies that schools will be using to mitigate those risks. I'd like to tell you about the strategies the K through 12 schools will be using to safely reopen. Firstly, according to the CDC, evidence shows that schools that have strictly implemented prevention strategies can safely reopen and remain open. Secondly, the CDC has presented guidelines for safe in-person instruction, which include the proper use of masks, physical distancing, and other prevention strategies. And lastly, the CDC has recommended increased testing of individuals that are suspected to have contracted coronavirus and full vaccination for all teachers and staff. I'll begin by talking about the evidence the CDC has used to show that schools can reopen safely. As you know, COVID-19 seriously affects the elderly and individuals with compromised immune systems. Thankfully, children have largely been spared from the serious consequences of the virus. In fact, according to the CDC, less than 10% of COVID-19 cases have been among children ages 5 through 17. Furthermore, the children that do contract COVID suffer less severe symptoms and sometimes no symptoms at all compared to those of the older population. Another important aspect of the decision to reopen schools is the fact that even though COVID-19 can be spread by asymptomatic carriers, according to the CDC, data shows that community spread is not preceded by schools reopening. So, children do not catch the virus as easily as adults, and they do not suffer, generally do not suffer severe symptoms as adults. And also, data shows that school reopenings do not exacerbate community spread, but at most parallel what happens in the larger community. I've talked about scientific evidence showing that schools have implemented COVID strategies have been shown to be able to safely reopen. Now I'd like to talk about those strategies more specifically. The CDC has provided guidelines for schools to safely reopen. According to San Diego Unified School District, every school has completed a reopening safety checklist that details the procedures and equipment put in place on each campus. Because we're all too familiar with most of these strategies, I'll be brief. Masks. Schools will require the correct and consistent use of masks in all areas of the school. Physical distancing. The CDC recently has allowed spacing of 3 feet apart for elementary school students, with the recommendation that schools proceduralize cohorting. What cohorting means is creating pods of specific children who can gather together and minimize the mixing of those pods. 6 feet remains the recommended spacing for adults and older children. Other important mitigators are increased hand washing, cleaning, and ventilation. Lastly, the CDC recommends increased testing for individuals suspected of contracting COVID and vaccination for all teachers and staff. I'm happy to say that all 3 of the teachers in my family have received their second doses of the vaccine. Because of the scientific evidence provided by CDC showing that school reopenings do not exacerbate community spread, and because of the preventative strategies being implemented by San Diego Unified School District, along with mask and physical distancing, I'm confident that it is safe to send my kid back to school. All this information should be taken on an individualized basis per each family to make the best decision for their children. I hope this information helps you make a decision about whether or not you think it is safe to reopen schools. And don't forget to apply to the poll. If you think that it is safe to send your kids back to school, comment right on. If you think that you'd rather wait, then hit the like button. Thank you.